Tim Vickery is our correspondent joining us now live from Brazil. Tim, good evening to you. Tell us more about this vaccination operation.
The total number of coronavirus hospitalizations in Manaus in December was 550. The total number in January was 3,500. The second wave has exploded. And the variation, according to the specialists, the variant, is not the cause of the second wave. It's the consequence of the second wave. It's the consequence of inadequate testing and tracing. It's the consequence of inadequate social distancing. Clearly, the situation worsened by the end-of-year festivities and also protests against lockdown measures in Manaus towards the end of the year. So the situation has been critical for some time. The vaccination process has started. Brazil has a world-class record in vaccinations. Do they have enough vaccine? Can they organise the vaccination with enough efficiency? These are crucial questions because specialists for the past two and a half weeks have been warning about a third wave striking Manaus. And the especially worrying thing for Brazil here is that in the first wave, as Manaus went, so did Brazil.
Is this in some way, Tim, an indictment of President Jair Bolsonaro and his, COVID skepticism that we saw at the beginning of the outbreak?
The electorate will be able to make that decision in the next presidential elections. One would have thought that Bolsonaro would be left in a very vulnerable position after repeated denials of the seriousness of this. Remember, on March the 22nd, he said that the total COVID death toll in Brazil would not exceed 800. We are about to go over 228,000. And he suffered a blow a couple of weeks ago when Brazil's Sanitation Vigilance Agency declared that the anti-malaria drugs that Bolsonaro has enthusiastically been supporting have no effectiveness against coronavirus. So you would have thought that posterity will judge him harshly. We will see at the end of 2022 how the Brazilian people judge him.
Indeed. And the situation in Manaus, as you say, it sounds like basically the whole system there must be on the verge of collapse. I imagine the hospitals are overwhelmed.
Yes. The city not able to treat all of its patients. Some have been flown out to other cities. An investigation will take place to apportion blame. There's a lot of blame game going on at the moment between the various levels of government, the national government and the local government, to determine who is responsible for the insufficiency of oxygen. But that death toll that I gave you, nearly 228,000, that has been boosted by people who didn't die directly from COVID, but they died suffocated through lack of oxygen.